IHE is about integrating standards to exchange information and making sure that it can be deployed in actual healthcare delivery organization, region, and country by putting this interoperability into products that are used in those deployments and connecting the dots between standards, deployments, and products. IHE started with a problem the Radiology Society of North America had, which was their radiologists in their hospital could not exchange imaging information, patient information, in an effective way. The system did not connect. They had to manually re-enter information all over the place. In solving that problem, IHE was born and then expanded to beyond radiology, to IT infrastructure, to cardiology, to laboratory, and then grew into Europe. IHE-Europe created the connectathon testing in Europe, and then it grew to many other parts of the world, including China, including Korea, including Japan, and that made IHE truly international in that span between the late 1990s to 2015. At the same time, in the late 2010, the concern of exchanging health information moved from within care delivery organization to region, nation, and cross-border. IHE expanded its scope to cover all of those environments. So the main thing that IHE is trying to solve is to realize that we have a very broad field that has a lot of clinical depth and that has a lot of deployment complexity from local to regional to national to cross-border. And to connect the dots across these various scope and these various clinical content is what IHE continues to maintain and basically has a methodology so that you can take any project and say, what is your need? How we can help you do a specification based on the IHE building blocks that you need and make the deployment and the testing of the deployment, because interoperability, if you don't test it, you really achieve nothing. And that's why IHE is always insisting we need good use case, good spec, and good testing. The future of IHE is to continue sharing and leveraging its experience, its knowledge, and making sure that it is usable and widely reusable across many projects across Europe, all fitting in a more consistent way under the EH data space. We think there is a very practical role to ensure that our experience of making sure the vendor product can be tested, can actually work, can meet the specification, and can connect and can deploy at such a large scale. That's a big challenge. We believe we have the ingredients to make this challenge met and be successful in Europe.